Welcome, everybody. I'm Josh Fenton. It's GoLocal Live, 12 o'clock news with Dr. Michael Fine, former head of the Rhode Island Department of Health. Let me just recap a number of things that have happened this morning. I'm going to exclude Tom Brady leaving the Patriots. The stock market is up at the midday at about 3%. The White House just had a press briefing. No major news out of that other than the effort to allow more flexibility to the states in testing. And earlier this morning, we had a woman Skype in from Bolzano, Italy, giving her experience over the past 10 days of lockdown. Dr. Fine, let's go to the numbers. What is the case in the globe and all the way to the United States right now?
Well, things are changing. There are now about 80,000 people around the world who have recovered. There are about 189,000 cases across the world. That's an increase of a little over 14,000 cases in 24 hours. In the United States, we have about 5,000 cases and about 1,200 new cases with 93 deaths. As far as we know so far, our Rhode Island numbers, we still have 21 cases. It's worth understanding that, as you look around the world, we're actually at the moment doing pretty well. That doesn't mean that more trouble isn't coming. But at the moment, our number of cases per million people is about 14. As a nation, as a state, it's actually about 21. That compares to places like Italy and Switzerland, which are running, 230 to 270 cases per million. So we're doing at the moment okay. This will change, and some of the world numbers are a function not just of how many people are sick, but of how much testing there is. And you got to take that with a grain of salt. Again, I expect as we start doing more testing, as we are, that we'll see the numbers in Rhode Island and the United States go up. Some of that's disease and some of that's testing alone.
We are seeing the first signs of lockdown in California. 7 million people are to shelter in place. This includes Silicon Valley, one of the biggest economic hubs of the United States. Earlier today, we had Rebecca Cotto da Silva Skype in from Bolzano, Italy. She talked about what her experience has been over the past 10 days. We certainly could see a full U.S. lockdown, couldn't we?
Sure. My sense is it's going to vary a little bit by location, so that places that are more dense and that's more likely to happen and likely to happen sooner. But a full lockdown can't hurt. The more we get this social distancing happening, the better we are at lowering the height of the curve. The thing that I'm paying attention to now is I'm paying attention to the number of new cases, as you heard before, and the relative increase in that number. That will tell us where we are, how we're doing, and when we've hit the peak and when we've started to ease off a little bit. If you look at how the WHO is reporting cases in China, they are no longer reporting by province. They're only reporting for the nation as a whole. And most amazingly to me, in China, a nation of 1.4 billion people, 24 hours, they had 29 new cases. So they've really gotten on top of this.
We're obviously seeing a lot of government intervention in controlling how people are meeting and greeting each other. Yesterday, the governor trimmed back the number from 50 people to gatherings of 25. Later in the afternoon, the CDC instituted a recommendation to the states of 10 people in gatherings or less. And for those over, I believe, 60, down to 5 people or less, but really asking them to be completely separated. Supermarkets have stepped up with shopping hours limited to those 60 and older. What will we see next, and how much isolation do we need to see develop?
Well, obviously, the more isolation we can get the better off we are. There were interesting recommendations from the Department of Health yesterday about how to take care of people who have a cough and fever but aren't seriously ill. Those recommendations were isolate as much as you can at home, regardless of what the actual diagnosis is. Plan to spend 7 days at home, and don't come out again until you've been 3 days without having a fever. And those are really good suggestions, because in a certain way, it doesn't matter so much what the source of the fever and the cough is, as long as the symptoms are reasonable. So I'm beginning to think about in my own house, and I'm suggesting other people begin to think about creating what I'm calling a hibernation room. One room in the house where you can go if somebody in the family gets sick. That's because in the Chinese experience, most of the transmission happened inside families from person to person. So if somebody gets sick, I think you want to get them into a quiet room, if you can, with its own bathroom. Make sure that they have lots of fluids. Make sure they have access to Tylenol or ibuprofen to control the fever. Make sure there's a thermometer there. Put food in front of the door, or get a little dorm refrigerator that you have set up and ready to go, so somebody can not have to come out very much. Make sure that they have a computer and a cell phone and all the music that they can listen to, and lots of books and things to write on, so they can sort of be quiet, be in hibernation mode, as it were, for about 7 or 8 days. If everybody does that, the moment they get sick, we'll be way ahead of this. And then obviously, if you're in a room like that and you get a high fever or you get short of breath, then you need to make a call about medical attention.
This afternoon, we're going to see more developments. Listen, we were lucky yesterday. There was, virtually no new cases in a 2-day period. You've talked about that the number of new cases could double every 5 days. What number is it that we need to hit a panic button, go to full lockdown, and even consider more significant restrictions?
Boy, I don't know what number. I don't think there's a magic number. As I've thought about this, I think we will likely peak at about between 100 and 200 new cases a day. So when we're seeing that doubling of new cases every day, we know that it's really out there and really getting people sick. And at that moment, then we really that doubling every day tells me that we really need to absolutely lock everything down. But I got to tell you that I think Rhode Islanders are doing a fantastic job, really a fantastic job, kind of getting quiet, going to ground, being careful about social interactions. I think we may be. I don't want to say we're ahead of this. We're certainly not, but I think we're going to do as well as anybody if we keep our eyes on the ball and keep doing what we're doing, which is being thoughtful and careful in every location and at every step.
We are supposed to, let's tie in the weather factor. We'd had some seasonably warmer weather, then we had a little overnight cold and a tiny bit of sprinkling of snow, but we're supposed to get warmer today and through the weekend. As if this manifests like flus do, that should help curb the spread. Talk about that from an epidemiology standpoint of how the warmer weather curtails the maximization of the virus.
Boy, it's a really interesting question, and this is really based on just a couple of studies, maybe one study from 2007, done of all things in guinea pigs. But it's done on influenza virus. What appears to happen is if you cough, remember this is spread by respiratory droplets. What appears to happen is those respiratory droplets in cold weather, and all the water in them evaporates very quickly. And that leaves the viruses still floating in the air and able to infect other people. If the same cough happens in moist, warm air, the respiratory droplet actually takes on water, gets heavy, and falls to the ground and doesn't infect other people. So that's the mechanism as far as we understand it. There may be some other mechanisms involved because people in really temperate climates, sort of see flu spreading in rainy season. That may have to do with when people are clustered together in houses. So there are a couple of different operating pieces, but the epidemiology is actually quite interesting, and that warmer weather does in fact promise some potential reduction in the spread of the disease.
Thank God for the guinea pig.
Yeah.
Last issue, we got notified after a number of requests from the Department of Health about information relating to Memorial Hospital in Pawtucket. It closed January 1, 2008. Care New England shut that down as part of their economic cutbacks and trying to balance their balance sheet. Health department said they haven't even looked at it. They didn't even inspect the building. What does that mean, not only for additional bed spaces? There's about 3,400 in the state of Rhode Island, according to the Department of Health. What does that mean to our capacity to provide health care if things maximize?
Well, it depends on what beds are available elsewhere. It looks to me like we're going to have somewhere between 200 and 500 people who are going to need ICU care if our experience is like the experience in Wuhan. And I believe we have about 160 ICU beds. So if we get pushed, we're going to have to invent them someplace. Now, Memorial has a bunch of hospital rooms in one place, but other hospitals likely have unused wings or unused floors that could also be opened up. Part of the challenge is the physical space. Part of the challenge is to staff all this.
Right.
And to sort of bring up and put into play the health professionals who need to man those beds and ICU beds. And that's just on one side. Remember, that's ICU care. The other thing the Chinese did that we're not talking about as far as I know now is they created isolation hospitals where anybody who was sick got pulled out of their houses and brought to this hospital where they stayed until they recovered. We haven't had that discussion as far as I know, but it's one place we could go if things get better. And it's something for people to understand, and it would be very different for us because it means if you go to an isolation hospital, you're there without your family, who can't come to visit you during the period you're sick. But I haven't heard a real discussion about that, but it certainly has to be one of the cards that we could play if things get worse.
Well, in China, they also built one hospital in 8 days and another one in 15 days in the province of Wuhan. So I'm not sure we're capable of that type of approval process and construction schedule. Accordingly, Boston actually has closed down construction sites during this period. Last question, what's your advice to folks? It's easy the first couple days to deal with the isolation and the disconnection. What can folks do over this next, really it's going to be about at least another 10 days and maybe significantly longer?
I think people need to use their creative impulses, and this is when you call your friends once a day just to check in. This is when you try to participate in things across the internet, through Zoom and other platforms, so that you're interacting with people in whatever way you can. And this is, I think, where you read and write and watch movies and imagine things. This is where you let your creative impulse and your imagination, really kind of take over and bloom a little bit, because in our busy lives we rarely have the chance to do that.
I have a Thomas Edison biography that I am dying to read. We've been a little busy on the news side of things. Dr. Fine, thank you once again for Skyping in today. The news of this is wildly dynamic. We appreciate your expertise and your being able to react to what's going on. I want to thank everybody for tuning in. I believe our next live is at 1 p.m. It will be broadcasting Governor Gina Raimondo's press conference from the administration building. I believe she will have some significant news there. Please pay attention to the developments, and we'll try our very best to keep you informed, really 24/7. Thanks so much for tuning in. Thank you, Dr. Fine.
Thanks, Judge.